On the front line with the Defence Secretary.
Are you newly commissioned, I hear, is that right?
But this is no ordinary battlefield. Right now, Middlesbrough has the highest COVID case rate in the country. This hospital's unique relationship with Forces medics is helping turn the tide. But a year into this crisis, even with military support, everyone is shattered.
And how are you all on sort of tiredness, exhaustion? I mean, it has been full on for all of you in a way that...
It's been very full on, really, and our NHS teams have been fantastic, but we are becoming exhausted, and the teams are becoming exhausted.
The forces have been working hand in hand with the NHS here for years, but during COVID, their skills have made all the difference.
They've helped us with our vaccination centre, they've helped us at all levels, even in our command and control structure. We've learnt from them on how to run, in this pandemic. It's been just a brilliant, brilliant relationship, and we couldn't have done it without them.
But even when case rates fall here and patients are discharged, the non-COVID wave begins. People have been waiting for treatment. There will be no break. What's happening here mirrors the rest of the country. In some areas like A&E, they're starting to see the light at the end of the tunnel, but the closer you get to the heart of this hospital, the further away normal feels. Michelle is in charge of intensive care.
We're still experiencing the same pressures that we had in the first wave back in April last year. We've seen 3 definite peaks, and we're still at the peak in the northeast of England. The vaccine rollout hasn't had an impact on critical care admissions yet.
It mustn't feel like you're about to get a break.
So at the moment we're still seeing new patients with COVID admitted, and we know that they're going to be with us for a number of weeks. And we know that there's a big backlog of patients who are waiting for care, and we're aiming to deliver as much care as we possibly can to everybody who needs it.
And the battle against COVID will carry on too. But ministers know burnt-out NHS staff can't carry on like this forever. Now the Defence Secretary is promising extra help.
I know people are going to be exhausted in this hospital, and that means we have to care for them and give them respite so that when hopefully things get back to normal, they're not running on empty. And so, we'll be looking in Defence about how we can help the NHS deliver that, how Defence can just find the right people to relieve some people, to give them that break. I think that'll make all the difference.
Talk in Westminster is about lifting lockdown and can we book a holiday? Is that the right message to be giving to people who are still struggling?
We all feel it, we all have been in a 12 months plus of some form of lockdown, and personally we all feel it. And, it's like a devil and an angel on our shoulder, and I wouldn't pretend it's any different. So, but the key thing is to remember, it is about making sure the flow into hospitals are managed, because if that falls over, that's when we get into real problems.
On Monday, Boris Johnson will set out his plan for ending lockdown. And like all of us, he's wrestling with the choice between offering hope for the future and protecting the most vulnerable. After such a difficult year, the staff here hope he gets it right. Kate McCann, Sky News, Middlesbrough.